Hello and welcome. My name is Dr. Calliope and I'm going to be performing your examination today. How are you feeling today? Okay. Well, I hope by the time you leave the office you feel even just the littlest bit better. Okay? Alright, would you mind just confirming your name and date of birth for me? Yes, let me write that down. Excellent. And is that the preferred name you go by? Okay, wonderful. Excellent. So it looks like we have you booked in for a respiratory examination today. Is that correct? Wonderful. And is there any particular reason you wanted this examination today? Okay. Excellent. So I'm just going to ask you a few questions before we begin on the examination, all right? Wonderful. Are you currently in any pain or experiencing any illness at all? Okay. So, touch allergies. And what kind of symptoms are you experiencing with that? Okay. And does anything help that at all? Have you tried any over-the-counter medicine or anything like that? Okay, and that usually helps quite a bit. Yes, I absolutely feel you there. My allergies are in full swing. Any changes to the medical history that we have on file here? Okay. And any changes to your family history at all? Any new diagnoses? Very good. And what about your allergy list, save for the seasonal allergies that you're experiencing? Okay. And what about your medication list? Anything new there? Any changes? Wonderful. Excellent. So, that looks great. So, for our examination today, I'm going to be taking a general look at you. I'm going to be checking your hands and your arms. I'll be checking your face and your eyes. We'll take a look at your lymph nodes. We'll listen to your heart and your lungs. Check a couple things on your legs and feet. Okay? So, pretty painless examination, I would say. Okay? So, if there is any pain or discomfort, I want you to please let me know, okay? Alright. So, for this examination, I am going to need to be touching you. Is that okay with you? Do I have your consent to do that? Perfect. Thank you so much. So, I'm going to start by taking a step back, and I'm going to just do a very general inspection of you, okay? So, just going to take a look at you and see if I note any signs of cyanosis or any changes to your pallor. Have you had any issues with shortness of breath, or a cough? Okay. And do you smoke at all? Okay. Have you ever? Very good. Glad to hear. So, let me just note that down, general inspection. And then we're going to be taking a look at your hands. So I want you to just hold out your hands for me, okay? Yeah, I'm just going to be looking for any abnormalities, any changes in color, any swelling, things of that nature. Okay, looking good so far. Wonderful. So I want you to do a little test for me. If you could put your index fingers together like this, okay? Just the first joints touching each other, okay? And I'm going to be looking for just a small little window in between your fingers. And that will rule out any possibility of clubbing at all. Okay, that looks great. You can go ahead and put your hands down. So I want to just real quick assess the temperature of your arms and your hands. So I'm just going to have you relax your arms, and I'm just going to use the backs of my hands to make sure that the temperature is warm and consistent throughout your arms and hands, that you're having good circulation. This looks good. Okay, so now I'm going to have you hold out your arms for me, okay? Just as such. And I want you to keep them as still as possible. I'm going to be looking for a fine tremor. Some people have tremors even if they don't have any respiratory issues. I'm one of those people, side effect from a medication I took many, many moons ago. But if there is a fine tremor, then we may have to take a closer look. Okay. I want you to now cock your wrists back and hold still. And I'm just going to be taking a look and making sure there isn't a sign of a flapping tremor. Okay, and that all looks good, so you can go ahead and put your arms down. Let me go ahead and take some notes on what we've looked at so far. Wonderful. So I'm going to be taking your pulse now, and I'm also going to assess your respiration. So I want you to please just breathe normally for me, okay, while I take your pulse. So I'm going to check here. Okay, excellent. So 80 beats per minute, and respirations are well within normal limits. Great. So I want to check your jugular venous pressure now. So I'm going to have you lay back onto the table there. Okay? All right. Can you turn your head to the left, please? Perfect. Okay, so now I'm just going to be watching your sternocleidomastoid area to see if I see any issues there. Okay, so now I'm going to be looking for any hepatojugular reflux, which means that I'm going to be pressing on your liver, okay? Have you had any pain at all in your stomach area? Okay, all good? All right. I will warn you, this will be a little uncomfortable as I'm going to be quite firm in pressure, okay? Please let me know if it's too much. All right. So I'm just going to press very firmly on the liver and look at your neck area. Okay. Alrighty, very good. So you can go ahead and sit back up. I'll give you just a second to get reacquainted with sitting back up. Wonderful. I'll readjust my stethoscope here. It seems to want to slide. Don't want that all of a sudden falling on the floor. Happens a lot more than you would think, but I always sanitize it right afterwards. Don't worry. Okay? Alright. So now I'm going to have a little look at your face and your eyes. Okay? So I'm going to be looking for any skin changes or pallor issues. Just going to make sure that everything looks normal. Okay? And I want to check your conjunctiva. So I'm going to be pulling down on your eyelids, and I want you to look up for me. Okay? Pulling down, look up. Excellent. And now I'm going to pull up. I want you to look down. Okay? Pull up. Look down. Very good. Okay. I like the look of that. It looks great. So I want to have a little look in your mouth and make sure there's no signs of any cyanosis at all. Okay, can you open your mouth for me? Yeah, let me grab my little light here. I want to see if there's any signs of any fungal infections in the mouth. Okay, can you lift your tongue to the roof of your mouth for me? Perfect. Thank you. Excellent. Okay, you can go ahead and close your mouth. Alright, we are trucking right along. Here we are. Just a couple more notes here. Okay. So I'm going to have a little look at your trachea, okay? So this might be a little uncomfortable. I'm going to be feeling around and whatnot. It might be a bit firm. And I'm going to check the cricosternal distance, which hopefully is about 3 to 4 fingers, okay? Alrighty, so just bear with me here. I know it's not incredibly pleasant. Doing okay? Okay. And that cricosternal distance looks normal. Okay. So, all good there. All done. I know that one's not very fun. So now I'm going to be inspecting your chest and your chest wall in particular. So firstly, I want to make sure there aren't any scars from any previous surgeries. I know you had mentioned that you didn't have any, but I want to be doubly sure, while we're here. So if you could just raise your left elbow for me, okay? So your arm is parallel to the floor. And I'm just going to inspect the chest wall over here. And can you raise your right elbow for me? So that I can look at this side right over here. Wonderful. Okay. You can put your arms down. That's great. Okay, so now I'm going to be palpating your apex beat, okay? So this is going to be in the mid-clavicular line and 5 intercostal spaces down, okay? I'm just going to be placing my hand on your chest there and feeling for the apex beat. I'd like to check for chest expansion. So I'm going to put my hands on your chest, and then I'm going to have you take a deep breath in for me, okay? All right, so place my hands on your chest here. Take a deep breath in for me. And out. Very good. Let's do that once more. Deep breath in. And out. Very good. Okay. So, note that down real quick, and then we will move on to some percussion. So, there we are. Okay. Put that down real quick. So, for our percussion today, I'm going to have my hand on different parts of your chest, and I'm just going to be tapping along that so that I can hear what sounds reverberate back to see if there's any issue in the lungs. Isn't that fascinating? Yeah, never ceases to amaze me. So first, I'm going to start in the supraclavicular area, okay? And infraclavicular, and the chest wall, and the axilla. Okay, very good. So now we're going to move on to auscultation, which is a fancy long word for taking a little listen, okay? So I'm going to listen in those same spaces, okay? I want you to just take a deep breath for me. Deep breath out. Deep breath in. 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 Deep breath out. Now, last of the axilla. Deep breath in. Deep breath out. Deep breath in. Deep breath out. Very good. So let me note that down, and then we'll do our vocal resonance test. So for our vocal resonance test, I'm going to be auscultating all those different points again: supraclavicular, infraclavicular, chest wall, axilla, and every time you feel the stethoscope on your chest, I want you to say the word 99, okay? All right, so 99, 99, 89, 99, 99, 99, 99. Okay. Excellent. We'll be doing all of those same tests on the back of your chest wall as well, your posterior chest wall as opposed to your anterior chest wall. Okay, so for the next few parts of our examination, I am going to be in the back of you, okay? So I'm going to be palpating your lymph nodes. We're going to be inspecting your back again. We're going to be doing our percussion, auscultation, and vocal resonance, okay? And chest expansion as well. So I won't be visible for those times, okay? All right, just wanted to let you know so that you're not caught off guard, okay? All right, so I'm going to go ahead and swing to the back of you. And let's see. Very good. I'm going to set my clipboard down. There we go. Okay. So firstly, we're going to have a little palpation on your lymph nodes, okay? So I'm going to start under your chin. We're going to do the submental and the submandibular and the preauricular here and the postauricular, okay? And the superficial cervical rather. Okay, deep cervical, posterior cervical, and supraclavicular here. Very good. Okay, that all feels great. So now I'm going to take a look at your posterior chest wall. So I'm going to have you cross your arms over your chest, okay? So one hand is on the opposite shoulder, other hand on the other shoulder, okay? Alrighty. And I'm gonna just measure your chest expansion here. So I've got my hands right on your back. And I want you to take a deep breath in for me. And out. Okay? Deep breath in. And out. Wonderful. Okay, so now we're going to move into our percussion. So I'm just going to be tapping along your back in 8 different spots, okay? Alrighty, ready? Okay. Okay, and then I'm going to put in my stethoscope and we're gonna take a listen to those different spots. And I'm just going to have you take a deep breath in and out when I put the stethoscope on the spot, okay? Deep breath in and out. 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 Okay. So now we're going to do our vocal resonance. So when I put the stethoscope on your chest, I want you to say 99, okay? All right. 99, 99, 99, 99, 99, 99, 99, 99. Excellent. So I'm going to take out the stethoscope, and then I'm just going to feel for any sacral edema on your back here, okay? So you'll just feel my fingers on your low back. Okay. I'm not seeing any signs of that. So I'm going to come back around, okay? I am back once more, so I'm going to take some notes here real quick. And then there's just a couple more tests that we have to do before you're all good to go, okay? All right, so let's see. Very good. So now I'm going to assess for any deep vein thrombosis in your calves, and then I'm going to check for any pedal edema, okay? All right, so I'm going to disappear from view for just a minute or two, okay? So I'm just going to palpate and inspect your calf here, looking for any signs of DVT. Okay, and now I'm just going to feel around your ankles so that I can feel for any pedal edema. Okay. All right, that all feels great. So give me just a moment, I'll come back up. All right, there I am. So I suppose a minute or two was quite generous, wasn't it? Figure it's better that I come up sooner as opposed to later. So I believe that is it. That is everything. Do you have any questions or concerns for me at all? Yes. Yes, you have a clean bill of health. Your circulation looks great, your lungs sound great, okay? Everything looks good. Nothing out of the ordinary. Okay? Wonderful. Let me go ahead and sign off. There we go. Okay. So that is it for our respiratory examination today. Okay? Is there anything else I can do for you at all? Wonderful. Thank you so much for coming into my office today for your respiratory examination. I really appreciate having you here. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Thank you so much for watching. I really appreciate it. Please like this video if you want to, comment if you'd like to, and subscribe